Howdy, my name is Chelsea Knudsen. I'm a registered nurse and the Teaching Associate Program Manager at the Clinical Learning Resource Center with Texas A&M University.
And my name is Andrew Robler. I'm the Standardized Patient Training Program Manager here at the Clinical Learning Resource Center as well.
Together, we worked to create the PITA curriculum that you've been experiencing throughout your education here at Texas A&M University. The Clinical Learning Resource Center contributed a lot to this as well. Today, we're going to demonstrate a head-to-toe physical exam. This is going to follow your PITA curriculum, so please feel free to follow along in your manual to study and go over this again and again.
Come in.
Hi,
Hello.
my name's Chelsea. I'm going to be taking care of you today.
Nice to meet you. I'm Andrew.
Hi, Andrew. Do you prefer Andrew?
Andrew's fine, yeah.
Perfect. Okay, so what we're going to be doing today is a head-to-toe exam. I'm going to look at your head, your eyes, ears, nose, and mouth. I'm also going to be checking out your heart and your lungs and also your abdomen or belly area. I'll be assessing one joint on either side just for demonstration purposes today. And then I'll also be doing some neurological testing, which that's kind of funny, so I'll show you when we get there what that is.
Okay.
It's easy though.
Okay.
Okay, any questions?
I don't think so.
Alrighty, so if you could lean your head forward for me. I'm just looking here at your scalp. Any pain when I press?
Nope.
Okay. Let you fix your hair there.
No, that's fine.
Awesome.
Thank you.
All right, Andrew, and if you will hold this about 14 inches from your face.
Okay.
Perfect. And then can you read that bottom line with one hand covering one eye?
Okay.
Just don't peek through your fingers there. Can you read that bottom line?
428739.
Excellent. Can you swap hands for me?
Okay.
Other side.
42. Oh, maybe that's a 6739.
Excellent. Good job. You did great. So you have 20/20 vision. That's
Okay.
normal.
Good.
Alrighty. I'm also going to be assessing your vision on the outside. We call that peripheral vision. So I'm going to have to get a little close to your face to assess this, but it'll be brief. Okay? Alrighty. So I'm going to get right about here. Alright, Andrew. I'm going to wiggle my fingers of one hand. I want you to tell me if it's the top hand or the bottom hand.
Okay. I can't tell. Top hand.
Good. Okay.
Bottom hand.
Nice.
Top hand.
Good.
Bottom hand.
Excellent. Perfect peripheral vision.
Okay.
Okay, Andrew, now I want to make sure that the muscular movement of your eyes is working. So keep your head nice and still and follow my finger. Good. And back to the center, and then I'm going to switch hands just for ease. Good job. Perfect. Okay, now I want you to focus on the wall directly behind my finger.
Okay.
And now I want you to focus on my finger.
Okay.
Excellent. Perfect. And then follow my finger in. Perfect.
Okay.
Wonderful. That was all normal. All right, Andrew, if you could take your glasses off for me. All right, I'm just going to look at your eyes here. I'm going to pull down on your eyelids. Can you look up and left and right? Wonderful. Okay. You can put your glasses back on for a moment. This I can do with your glasses on or off. Perfect. That looks great. Look right at the light. Alrighty, the next thing I'm going to do is I'm going to turn out the lights here. And if you'll take your glasses off for me. Look just right at me. Perfect. Good. Alrighty, that was all normal, so that's good. The next thing I'm going to do is look at you with a special light in your eyes. All right, Andrew. So if you look straight ahead, about 3/4 of the way up the wall. Excellent. There we go. A little bit further down. There you go. Perfect. All right, that looks really normal. I'm going to check your other eye. Okay, great. Alrighty, and now I'm going to look at the back portion of your eye. Just keep looking where you're looking. Excellent.
Here, I'll just turn this way. And you can do it on this side.
Okay. Great. All right, everything looks normal, Andrew.
Okay, is that okay to put my glasses back on?
Yes, you may. Alrighty. So that's all of your eye. I'm going to turn the light back on. Everything was normal with your eyes.
Oh, that's good to hear.
Yes, absolutely. The next thing I'm going to do is test your ears. Okay, so if you will close your eyes for me, which side do you hear this on? Your left or your right?
My left. Right.
Fantastic. I'm going to do some special tests for your hearing.
Okay.
Do you hear this equally in both ears?
Yes.
Okay. Can you hear this?
Yes.
Can you hear this?
Yes.
Which was louder?
The second one.
Okay, I'm going to do the same thing on this side. Can you hear that?
Mm-hmm.
And how about this?
Mm-hmm.
And which was louder?
The second one.
Excellent. You're good. Alrighty, so all your hearing tests were normal. Now I'm going to look at your ears on the outside here. And then any pain when I press here?
No.
How about here?
Mm-mm.
And when I tug?
Nope.
Alrighty, can you turn this way just a little bit? And then any pain when I press on your bone here?
Nope.
Okay, how about when I press here?
Nope.
When I tug?
Nope.
Okay, good, perfect. I'm gonna look inside your ear.
Okay.
Alrighty, I'm gonna tug on your ear just a little bit here.
Hmm. I think I have a lot of earwax. I apologize in advance.
Apologize for your earwax, it's normal. Alright? Yes. Alrighty. Everything looks normal, Andrew. Alrighty. We ready? Alright, Andrew, I'm going to be pressing on some areas of your face. Any tenderness here?
No.
How about up here?
Nope.
Okay, good. Can you plug one side and breathe in and out? Good job. And then the other side? Perfect. Wonderful. So I'm just going to look inside your nose here for a second. Let me get a clean one of these, clean spatula. Alrighty, and can you look up just a little bit? Perfect. Excellent. And just breathe in and out through your mouth. Good job. Perfect. Alrighty. All done with that. Everything looks normal.
Great.
Next thing I'm going to do is assess your mouth and your throat.
Okay.
Okay. There you go. Alrighty, can you open your mouth for me? And keep your tongue inside your mouth. And then just say ah for me. Perfect. And then can you lift your tongue up? Good. Excellent. Okay, all that looks normal.
Okay.
Can you lean your head forward, like chin to your chest for me?
Mm-hmm.
And then back. Touch your ear to your shoulder. And then rotate. Any pain with any of that?
No.
Okay, I'm going to be feeling some of those structures in your neck. Okay, any pain?
No.
Okay. Alrighty. And can you shrug for me? Okay. I'm just gonna have to untie this just
That's
for a
fine.
moment if that's okay.
Mm-hmm.
Could let you do it as well. Okay, can you shrug for me? Okay. Sorry, that'll be a little uncomfortable, but it will be brief.
Okay.
Okay, and then right beneath here. Perfect. Wonderful. So no lymph nodes are swollen, so that means nothing is abnormal.
Okay.
Okay. Now I'm gonna find your Adam's apple
Mm-hmm.
and just relax your neck forward. Yep, exactly. Can you take a swallow for me? Okay, just making sure I was on your Adam's apple. Good. Okay, there's your thyroid. So I'm gonna do a special test for your thyroid. I'm gonna come from behind you, put my hands on either side of your neck. I'm not gonna choke you.
Okay, that's fine.
Alrighty. Can you look to your left? Alrighty, and now look to your right. Good, and look forward. Just regular, and then if you could swallow. Good, fantastic. All of that was normal. Your thyroid's normal as well.
Okay.
Okay. Alrighty, Andrew, now I'm going to be checking your lung function, so how you're breathing. So if you could lower your gown so I can see your chest. Perfect. Wonderful. And deep breath. Good. Okay, and then any tenderness anywhere?
No.
Okay, good. Alrighty. Can you turn this way so we can still see your back? Perfect. Alrighty. So I'm going to have you breathe all of your air out. Okay, and now take a deep breath in. Fantastic. Alrighty, I'm gonna put my hands on your back and I want you to say 99 out loud.
Okay. 99. 99. 99. 99.
Perfect. Any pain when I tap here?
Nope. No pain.
Alrighty, so now I'm going to be tapping some more. I'm gonna listen to some sounds. Can you cross your arms in the front? Perfection. Alright, Andrew. Again, let all of your air out.
Keep my arms crossed.
Yes. Take a deep breath in, fill your lungs with air. Okay, and you can stop. You can breathe normally. Perfect. All right, and I would repeat that on the other side. Alrighty, now I'm gonna take a listen. Can you take a deep breath in and out through your mouth like this? Good. And again. Keep those arms crossed for me, if you will. Good. Fantastic. Any lightheadedness or anything?
No,
Go
no,
too fast?
I'm okay for right now.
Good, wonderful. Okay, so now I want you to say out loud E.
E.
I'm going to do that again.
E.
Fantastic.
E. 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 E.
And last one over here.
E.
All right, same thing, but instead of saying E, can you whisper 1, 2, 3? Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Good.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. All right, Andrew, if you'll turn back to the front for just a moment. I'm going to listen to your lungs on the front side.
Okay.
Okay. Take a deep breath in and out. And then last one right under here. Excellent. Okay. Everything sounds really normal, Andrew.
Okay.
All right. So your lung exam is normal. We're going to move on to your heart now. All right, Andrew, you can go ahead and cover your chest. And then if you will lean back on our pillow back here, I'm going to adjust the head of the exam table up just a little bit first. Okay, and you put your head on the pillow.
Okay.
Perfect. Are you comfortable?
Yes.
Okay, good. Wonderful. So I'm going to be looking at some of the veins in your neck.
Okay.
Can you lower your gown just a little bit? Not as much as before. Perfect. I'm just feeling for where your second rib is, actually. All right, that looks about there. And I'm going to be looking for your vein. And can you look that way just a little bit? Perfect, yeah. Wonderful, and that's normal.
Okay.
I'm going to be feeling your pulses here. Good. Now in your arms. Good job. check one pulse that's in your
Mhm.
femoral area,
Okay.
so kind of in your groin region.
Okay.
A bit blood on for that. Okay, and if you could just lift your gown on one side for me. Perfect. Good, very strong. Okay, and now I'm gonna do the other side.
Okay.
Excellent. Okay, you can cover back up now, Andrew. Alrighty, so now I'm gonna check some pulses behind your knees. So if you could bend your knees for me. Good. Alrighty. Alrighty, and you can stick your legs straight out. Perfect.
Sorry, my stomach's making noises.
It's all good. Alright, perfect. All that was normal. Alrighty, so next thing I'm going to do is a special test called Allen's test.
Okay.
This is just to see how the blood is flowing in your wrist. So I'm going to put both of these. And then can you make a fist? Okay, and pump that fist. And now open your hand. Perfect. Alright, we're going to do the same thing one more time. Fantastic. And you could assess both sides if you want. Alright, I'm going to look at his nails. Make sure that his cap refill is good. I don't know if y'all can see that. Okay, and no bluing of his fingertips or his mouth. Okay, so now if you can move that gown back right where it was. Just feeling for a heartbeat. See if I feel one. Any tenderness where I'm pressing?
Nope.
Alrighty. Okay. Alrighty, now I'm gonna listen to your neck and your heart. Okay, can you take a deep breath in and hold it? And breathe normally. I'm going to do the same thing on this side. Alright, you can breathe normally again. Now I'm just listening to your heart. And then if you were doing a full cardiac examination or had any reason to suspect any kind of abnormal sounds, you can come back and listen in each position with the bell. Good. All of that was normal, Andrew. Your heart sounds really healthy.
Great. Thank you.
All right, Andrew, you can go ahead and cover your chest.
Okay.
And then I'm going to lower the head of the exam table here completely flat. All right, you can still put your head on that pillow. Are you comfortable? All right, I'm just going to cover your legs with this drape here. Okay. Perfect. Alrighty. And then can you lift your gown up to about your midline? Fantastic. Alrighty, everything looks pretty normal. If you'll put your hands at the sides. Fantastic. Alrighty, I'm just going to take a listen, just like we did with your heart.
Okay.
Good. Everything sounds normal so far.
Great.
All right, Andrew, those two places that we palpated in your groin region for where we pressed for the pulse, I'm needing to listen to those as well. Thank you for moving that. Perfect. Can you do the same thing on the other side? Perfect. Good. Okay, well, that's really normal.
Great.
Now I'm going to be tapping on you just a little bit here. Any pain with that tapping? Right. Okay. Okay, good. That's very normal as well. Alrighty, and now I'm going to be pressing on your abdomen just a little bit.
Okay.
Just gently. You said you didn't have any pain, so that's good. Okay, I'm going to press a little bit deeper now. Okay, any pain when I press like this on either side? Okay, any pain when I let go? Same here. Pain when I press? Pain when I let go? Okay. Good. Good, I'm just making sure that the spleen is not enlarged, so you can do that really specifically. And you can palpate for the liver edge as well, if you choose to. Alrighty, Andrew, deep breath in and out, nice and relaxed. Okay, and then take a deep breath in. Okay, good job, perfect. Alrighty, now I'm going to test some special tests for your appendix.
Okay.
So if you'll bend your knee for me, and then I'm going to rotate your knee in just a little bit, push in. Any pain with that? Okay, put your knee back down. And then can you press up for me? Any pain with that? Okay, that was all pretty normal. So we're done with your abdomen exam. And everything's normal.
Palpate for the airway.
Oh yes, and then this is part of, you can kind of think of part of cardiovascular as well. Sometimes this needs to be included for that. So I'm going to feel here, feeling for his pulse. Good. Also very important to assess in patients over 50, which Andrew's not. Okay, now I'm going to assess your jaw and your neck and your shoulder, and then I'll give you some more information as we keep going.
Okay.
Alrighty. Can you open and close for me? Okay, and grit your teeth really quick. I'm going to do gritting your teeth up here, part of neuro as well. Okay, can you jet your jaw out and in? And then open and close all the way. And side to side. Perfect. Any pain with any of that? Okay, wonderful.
It made me yawn. Sorry.
That's okay. Alright, the next thing I'm going to do is look at your neck. So I'm going to come from behind.
I'll rotate.
Okay, that's great. Alrighty. And I'm looking, this is normal here, normal lordosis and kyphosis and lordosis. Alrighty. Any pain when I press right in here on your bone?
Nope.
Okay, have it on the muscle. Okay, and we already checked the range of motion of your neck when we did head, eyes, ears, nose, and throat. So now I'm going to be assessing your shoulder. So I'm going to turn that to the side and then just expose one shoulder for me. Perfect. I'm going to show this on one side. I'm going to start the sternoclavicular joint. Any pain when I'm palpating your collarbone?
Nope.
Okay. There's the acromion. Okay. Acromioclavicular joint. You can also find it like this. Is your biceps tendon there? Any pain with that? Okay. Any pain in the back here? You have all right in here. Good. Can you move your shoulder back just a little bit? How about underneath here? A little bit more. There we go. Perfect. Pain in there? Pain in here? Okay, perfect. So now we're going to be doing some range of motion tests.
Okay.
So I'm going to have you flex your shoulder forward so you can just do what I'm doing. I'm going to step out of camera range so you can see Andrew. All right, Andrew, if you could just flex your arms up like this. Okay, good. And then you can bring them back down and kind of towards the back like this.
Okay.
Exactly. And then back to your side. Can you lift them up off from the side like this? Exactly. And back. And then can you cross that arm across your body? Yep. And you can even press. Excellent. Good. Your AC joints. Good. So that's fantastic. Now if you put your hands at your hips like this, and then move your arms in, and then out. And then I want you to do a special test called Apley Scratch Test.
Okay.
This is just, again, assessing a whole bunch of movements of your shoulder.
Okay.
So if you'll do this.
Okay.
And try and touch in the back. Yeah.
Oh my gosh, I can touch.
Excellent. And then if you'll do the other side.
And this side, I cannot.
Okay, it's important that the examiner look at that as well to see if they're similar or not. If you'll put both hands in the back for me, and I'm going to have you rotate around so that the students can see. Okay, right here and here, and then I'm going to press down on your hand, and I want you to push off. Okay, oh good, yeah, really strong. And here, good. Okay, and now you can face me. Perfect. Alrighty, so we're going to test some muscle strength. So if you'll put your hands out like you're holding two cans out to the side, dump those cans out, okay, and then bring it in just about 15 degrees. Perfect. I'm going to press down on your arms, so I want you to resist that.
Okay.
Good, that's normal. Put your hands in like this. I'm going to press in, you press out. Also normal. Can you stick your arms straight out for me? I'm going to press down. Okay, that's normal as well. Any pain? Okay, perfect. I'm going to lift your arm to the side here.
Okay.
And now I'm about 90 degrees here. Now I want you to do this by yourself without me helping you. Can you lower your arm back to your body? Perfect. That's fantastic. All right, now I'm going to do two kinds of impingement tests. Just means kind of like pinching basically. So I'm going to press on your shoulder here and let me move it for you. Good. Any pain with that?
No.
Okay. Now look at your wrist as if you're looking at a watch. Perfect. Any pain with that? Okay. 2 thumbs up for me. Alrighty. And I'm going to press down here and you just resist. Good. And 2 thumbs down. Good. Did it feel different? Okay. Perfect. All right. Your shoulder looks really healthy. So that's fantastic. Okay. Now we're going to assess the elbow. So I'm going to look at the elbow, look at all sides. Okay. And I can have him move it. I'm inspecting. So then I'm palpating. Okay. And then can you just come in and out like this? It's a hinge joint and then rotate. Perfect. So elbow's normal.
Okay.
Now I'm going to move on to your wrist. So I'm going to look at both sides and your hand. Fantastic. I'm going to be pressing here. Any pain in this area? Okay. And then you can flip your hand over for a second. Any pain with that? You stick your fingers straight out. Yeah. Any pain in there? In there. You press your thumb out against my hand. Perfect. Can you put your arms together like this? I will wait 60 seconds to see if he experiences any numbness or tingling. If he started to experience numbness or tingling, we could stop the test and consider it a positive. All right, now I'm going to be tapping on your wrist. Any pain with this? Nowhere. Okay, good. Awesome. And then if you'll stick both of your hands out like this. All right, and then if you'll grip and squeeze as hard as you can. Perfect. All right, everything seems really normal.
Okay.
Alrighty, now we're going to check Andrew's spine. So Andrew, could you untie this lower tie for me as well? Perfect. I'm just looking, inspecting for normal concavity and convexity. Everything looks really normal. I'm going to press on your bone here. Any pain with any of this? Really just use my thumb here to really press. Any pain with any of this? Okay. I'm going to do the same thing with your muscles. Any pain? Either side. Okay. Do you remember on a back pain complaint, you should also assess CVA tenderness. Okay. And now I'm going to do range of motion. So Andrew, can you touch your toes for me? Here, let me,
No, it's just gonna fold up. It's okay.
let's tie your gown. Good reminder. Tie the patient's gown before doing range of motion for spine. Or have them do it if they would like. Okay, and now lean back. Good, okay. And then can you go from side to side here? Okay, perfect. And then can you rotate? Good. Wow, really good range of motion. Alrighty, now I need to watch you walk. Quick note, during the palpation you saw my hand on Andrew's back. This is for stabilization if he needs it, but also so that I can feel any kind of muscle twitching if he had a muscle pain whenever he did certain ranges of motion. Alrighty, you can walk forward for me. I'm gonna watch you walk. Perfect. And then watch back. Perfect. There are some more gait tests that we'll be doing in neuro, but I'm gonna leave it at that for spine and then hip. So I am going to palpate. Any pain? Okay, and Andrew doesn't have those dimples there, so you just kind of have to imagine where they would be for the SI joint. Any pain there? Okay, so now I need you to lay down on the exam table to finish your hip exam.
Okay.
Alrighty, Andrew, I'm just going to cover you up here, and we're going to check out your hip.
Okay.
So can you move your gown up so I can see your hip bones? Perfect. Alrighty, and I'm just going to feel those right there. Alright, any pain there at all? Okay, good. Alrighty, I'm going to check some range of motion of your hip.
Okay.
So I'm going to put my hand right here, and then I'm going to take your ankle, pin it out. Alrighty, very nice. And back across. And I would repeat this on the opposite side. And then can you bring your knee in to your chest? Put your foot flat on the exam table and let your knee fall out. Cross back over. And then there are multiple ways to assess extension. For Andrew today, I'm going to have him roll to his side. And then I'm going to just to help him so that he has balance, can you move your leg back? Perfect. Fantastic. Don't forget to assess these things bilaterally. All right, Andrew, everything is normal.
All right.
Alrighty, now we're going to be assessing Andrew's knee. So I do want to compare one side to the other just like I would have for shoulder, but we're just doing one side today for demonstration purposes. I'm inspecting for rubor, dolor, tumor, calor, any signs of deformity or trauma, any muscle atrophy, things like that. So follow along in your PETA book. Okay, and I'm going to start by palpating right at his joint line. Okay, which I need to find it first. Swing your knee for me. There we go.
You're right in it.
Perfect. Just wanted to make sure I was in the right place. Any pain here? Medial and lateral collateral ligaments here. Posterior knee space. Okay. Answering bursa. Okay. And then I'm going to come up to his quadriceps tendon and press. Any pain here? I'm going to come all the way down to patellar tendon. Okay, alrighty. Andrew, if you could extend your leg with support. Perfect. Alrighty. I'm going to stand up so you guys can see really well.
All right, we're going to need to,
Okay, so I'm going to apply pressure here. I'll be palpating for any swelling. Okay. And a allotment test as well. Now mobility. Can you relax this muscle for me? There we go. Now I can move it around a little bit. Alrighty. Can you flex this muscle? Fantastic. Good. Wonderful. Alrighty. Now I'm going to be doing some special tests for your knee. So if you could kind of sit back. You can lay back completely if you'd like. Okay. And then if you'll bend your knee. Okay. And I'm going to sit on your foot here. And I'm just going to pull forward. Any pain with that? Seems pretty normal. Push back. Okay. Grab your ankle. Any pain there? Any pain here? Okay, if you'll point your toes kind of out here, and then bend your, yeah, there we go, 15 degrees. Okay, how's Lockman's test? Looks normal. If you'll put both of your knees up for me. And this one does require comparing one side to another. You'll also see some people move the legs like this to see if the tibia sags backward for PCL tear. Alright, that looks normal. Now I'm going to do a McMurray's test. So this is for your meniscus. I'm going to put my hand at the joint line, hand on his heel, and I'm going to move you into complete flexion. Fantastic. Rotate this in. Okay, and you can do multiple different positions here, just trying to graze the entire surface of that meniscus. Any pain with any of that, Andrew?
Nope.
All right, that was all normal. Good job. So now we're going to assess Andrew's ankle. So I'm going to be palpating deltoid. Any pain here? Pain back here? Okay, perfect. Any pain on this bone here? How about up in here with it? Okay. Can you point your toes for me? And then point them back up. And then can you rotate side to side? Yeah, exactly. Perfect. That's all normal. So I'm going to press right here. This is the 5th metatarsal, proximal aspect. You get injured, any pain there? Okay. And just general palpation, any pain anywhere. Okay, everything seemed really normal. I'm going to do a Thompson's test last. This is optional. This is for the Achilles tendon. So I'm going to squeeze on his hip and his toes should point slightly forward. This is more dramatic when we have him cross his leg, and Andrew, I'll just have you do this for us. And you can see his toes pointing. Alrighty, so we're done with that. Alrighty, now we're going to start neurological exams. So we're going to start with cranial nerve 1, which is our olfactory nerve. We've already assessed the patency of his nerves in HE and T. So Andrew, if you'll just occlude one side or plug one side, close your eyes and breathe in and out. Tell me what you smell.
Cinnamon.
Alrighty, and we're going to do the same thing on the other side. Alrighty.
Cinnamon.
Also cinnamon. Good. Doesn't it smell so nice?
I need a pumpkin spice latte.
Excellent. Okay, so the next thing that we're going to do is assess sensation in your face. So when we do light touch, we can do this with a Q-tip or with our hands. So just make sure that you're assessing multiple dermatomes. Does this feel the same or different?
It's same.
Same or different?
Same.
And then same or different?
Same.
Okay, and then I'm also going to do sharp and dull.
Okay.
So if you'll close your eyes, first of all, before you close your eyes, let me show you this, Andrew. This is what sharp feels like.
Okay.
And this is what dull feels like.
Okay.
Okay, so it's not super sharp, but there's a difference. So I just want you to tell me if you feel this is sharp or dull.
Okay.
Okay.
Dull. Sharp. Sharp, I think.
Yep.
Dull.
Let me do this over here.
Dull. Sharp. Oh, sharp.
Sorry.
It's okay. Dull.
Good.
Sharp.
Good. Perfect. You did a great job. Alrighty, so the sensation of your face is good. I've already assessed the masseter muscles and all the trigeminal nerve type things with movement of the jaw and all that in HE and T, so we can skip ahead to the next thing. So we could do corneal reflex here. We're not going to do this on our SPs or our PETAs, but I can demonstrate it. My hands are clean, and this is also clean. Bring it into a point. If you will take your glasses off, and I'm going to touch his cornea from the side, and you'll watch him blink. Yep, he'll have to blink. It's a reflex. People that are in coma will still do this if that cranial nerve is still intact. Sorry. Okay.
No, you're fine.
Alrighty, so now we're going to do the facial nerve. So Andrew, I'm going to have you make some funny faces. So can you lift your eyebrows up? Alrighty, and down, and close your eyes. Okay, and then I'm going to try and open your eyes. Good, perfect. Can you frown? Okay, and can you smile? Show me all of your teeth. Good. Puff out your cheeks. Perfect. All of that was normal. So cranial nerve 7 is good to go. The only thing left is cranial nerve 11 because everything else has been done in HE and T. So I'm going to press down on your shoulders. Can you push up? Good. And then can you press your face into my hand? Perfect. And how about on this side? Alrighty. So the next thing that we're going to move into is motor, sensation, and reflexes. Already starting to assess motor function of Andrew's upper extremities, meaning his arms. Andrew, if you could extend your arm for me. Perfect. I'm going to press in on your arm, and I want you to press back out. Just resist my pressure. Perfect. Fantastic. Now the opposite. Good. I'm going to do that over here as well. So press out. Good. And pull in. Fantastic. Good job. I'm going to do this with your wrist as well. So I'm going to push down on your wrist. Don't let me do it. Good. And now I'm going to press up. Good. Same thing over here. Up and then down. Fantastic. You'll stick your fingers out like this. And just try to hold them there. Yeah, there we go. Okay, all of your motor was normal. Now I'm just going to test sensation of your arms, kind of like we did with your face. So if you'll just close your eyes and tell me which side do you feel this? Right, left, or both, and you can say your right or your left.
Both. Left, right, both, right, left, left, both, both.
Fantastic. Alrighty, we're gonna do that sharp and dull thing
Okay.
again. Okay. So just tell me if it feels sharp or dull. Can you roll up these sleeves just a little bit? Alrighty.
Sharp, dull, sharp, dull, 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 sharp, dull,
Can you rotate your arm where you can get to the other side?
dull, sharp, dull.
And I'm going to repeat this on the other side for comparison purposes. Alrighty. And now I'm going to put something on your skin, and I want you to tell me if it's hot or cold.
Okay.
Okay.
Cold.
Okay, and is it different or the same over here?
Same.
Okay. You can also, if you want a warm thing, if your hands are warm, you can use your hands, but for the most part, we don't really have a warm thing in our office. So I'm going to put my hand on you. Is that hot or warm?
Warm.
Or hot or warm? Is it cold or warm?
It's warm.
Good.
Cold.
Sorry.
It's okay. Cold. Cold. Warm. Cold. Warm. Cold.
Good. Perfect. Then the last thing I'm going to do is vibratory sensation, well, and then I'll do proprioception. I'm just going to put this right here. Do you feel that vibrating?
Mm-hmm.
Okay, and I do that on the opposite side as well. I have your index finger. Okay. So I'm stabilizing all of his joints, putting my fingers on either side here. I'm going to have Andrew close his eyes. And then, Andrew, this is up and this is down.
Mm-hmm.
Okay, so I want you to tell me where I stop, up
Okay.
or down.
Up. Down. Down. Up.
Good. Good job. All of that was normal. So that's motor sensation. Then the last thing I'm going to do is reflexes of his upper extremities. So I'm going to do his triceps reflex. Disclaimer. Andrew's reflexes
Are bad.
can't find them. It's real hard. Okay.
So I'm going to use the Jurassic maneuver
Alrighty, so that's
Clench
going
my
to be him
teeth.
clenching his teeth.
and look
when I
away.
hit. Don't judge me for not being able to get Andrew's reflexes.
All right.
Okay. On 3, 1, 2, 3. Saw some twitching.
Mm-hmm.
Okay, that'll work for Andrew's purposes. Okay, now I'm going to do his, not brachial.
Biceps.
Biceps, thank you.
Mhm.
So I'm going to have him rest his arm like this. Okay, and then on 3, Andrew. 1, 2, 3. Let's do it again. 1, 2, 3. Saw this muscle twitch a little bit.
Mhm.
Did you feel it?
Mm-hmm.
I didn't feel it that time, but okay, that's how it's done on Andrew. Okay, Andrew, pull forward. Okay, and I see his brachioradialis muscle here. Do that one more time. I'm gonna end about there, so that's where I'm going to be aiming for. Nice and relaxed for me. Clench your teeth on 3. 1, 2, 3. Okay. Did you feel it as well?
Mhm.
Because I saw it. Okay.
Mhm.
Alrighty, so that's all the reflexes on the upper extremities. Thanks for being hypo-reflexive. It's cool. Alrighty, so now we're going to start motor sensation and reflexes of the lower extremities. So we're going to start with the hips. Andrew, I'm going to press down here. Can you press up? Fantastic. Same over here. Wonderful. And then can you pull back? Good. Pull back over here. Let me compare those actually. And then press out. Good. Press down like a gas pedal. Okay, and pull up. Fantastic. All of his motor of his lower extremities are normal. Then I'm going to do sensation, which I can do light touch first. Do you feel this here?
Mm-hmm.
Okay. And so we're going to do the same thing, different or the same.
Okay.
Okay, and different or the same?
The same.
Okay, and then right, left for both.
Right, left, both.
And were those all the same?
Mm-hmm.
Okay. Same thing down here.
Right, right, left, 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 both, 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 both.
Okay, and is that all the same?
Mm-hmm.
Fantastic. Right now I'm going to use sharp versus dull. And you can go down one leg if it's all normal, and then just go down the other leg. But if there are abnormalities, you do want to compare one side to another so you can really track where that abnormality is. Alrighty. Sharp or dull?
Sharp, dull, sharp, dull, sharp, dull, sharp, 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 dull, dull, sharp, dull, sharp, dull, dull, sharp, dull.
Good job, Andrew. Awesome. Alrighty, so now we've done pain, and then we can do temperature. So I can say, is this hot or cold?
Cold,
Okay, and does it feel different or the same?
same.
And we don't really talk about the hand warm thing in the PoM manual, so I'm just going to keep with this.
Cold.
Okay, and different on the same?
Same.
How about here?
Cold. Same. 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 And same.
All cold. Alrighty, and then vibration and proprioception. So I'm going to put this distal joint here. Do you feel vibration?
Mm-hmm.
Okay, and I'll do that on the opposite side as well. And then for proprioception, some will teach using the large toe because this one loses sensation a lot in diabetes. So if you're doing this kind of test, and they'll say do it in the big toe first. It's easier to do it on the second toe because it's a longer toe. So I'm going to demonstrate it on the second toe. All right. Stabilize all those joints. All right, Andrew, so this is up. This is down. Good, you have your eyes closed. I want you to tell me if I'm stopping it up or down.
Up.
Yeah.
Down.
Good. Good job.
Up. Down.
Good. All right, fantastic. Alrighty, so all of that is intact. Now the next thing I'm going to do is reflexes. So I'm just going to do a patella reflex. So gymnastic maneuver for this one involves the hands as well, pulling outward and clenching the teeth at the same time that you strike the tendon. Alrighty.
As much as possible.
You can do this.
Yep.
On 3. 1, 2, 3. Let's do it again. 1, 2, 3. Kind of move down here, Andrew. Let's do 1, 2, 3. All right. Good job. Alrighty. And this one, you just relax your foot down.
Yeah, just a little higher up.
Okay, how can we do this? There we go. Perfect. Alrighty, and I'm just going to have his toes in my hands, and I'm going to feel for plantar flexion. So 1, 2, 3. Not really. Okay. Relax.
Perfect.
1, 2, 3. That one I felt.
Yep.
Good job. Alrighty, so that's motor sensation and reflexes of his lower extremities. The only thing left is some coordination type tests, coordination and cerebellar function. Some of them are considered for proprioception, so we'll get to those next. Alrighty, Andrew, so I'm going to have you do some rapid alternating movements. So basically, I want you to put your hands on your thighs, and then can you move them back and forth as quickly as possible? Fantastic. Touch your finger to my finger. Now touch your nose. Okay, and again. And I want you to fully extend your arms, so I should probably move back a little. Fantastic. Good. Wonderful. So I'm going to have you drag your heel from your knee all the way down your shin. I'm going to have you repeat that on both sides. This is, again, point-to-point movements. Okay. And now I'm going to be assessing some additional things with his gait, which I'll show you in just a second. We're going to go ahead and do Romberg and pronator drift in this position.
Okay.
So if you'll stand up for me. Okay. And extend your arms out. Feet are together.
Okay.
Alrighty, if you'll close your eyes and just maintain this posture, okay? This is a 30 to 60 second test. I'll press down on his arms and see if they bounce right back up to where they're supposed to be. Fantastic. Negative Romberg and pronator. And then I will assess some things with his gait, so we'll change views for that really quick. Okay, Andrew, I'm going to have you walk toe to toe like you're walking on a tightrope. Exactly. Fantastic. Good job. Can you walk back on your heels? How about on your toes? And can you squat and do a duck movement like that? Perfect. Fantastic. All right, everything is normal. All right, guys, make sure you reference the information about a skin assessment in your PoM manual as well. That's something that you're going to want to be assessing the entire time throughout the physical exam. And then teach your patient the information that they need to know about skin self-assessment, risk factors. All of that information is at the end of your PoM manual. We want to thank you for your time and attention. I hope this was helpful.
Thanks and gig 'em.